Hello everyone, in this session we are discussing about articulator, regulation, mounting and teeth arrangement. For now we will discuss about articulators. Coming to the articulators, what is the definition? Definition is a mechanical device which represents the temporomandibular joint and the jaw members to which maxillary and mandibular cast are attached to simulate the jaw movements. Coming to what are the functions of articulators? It is used to hold the maxilla and mandibular cast in a planned relation. It is used to stimulate the patient's TMJ, maxilla and the mandibular movements to open and close similar to the patient, to teach and study the occlusion and the mandibular movements, to arrange the artificial teeth and to mount the cast for diagnosis, treatment planning and patient presentation. Coming to what are the advantages of articulator? The advantages include it provides a better view for the patient's occlusion, especially the lingual side which cannot be seen in the patient's mouth. Patient's tongue, saliva, cheeks are not a factors of hindrance while using an articulator. Some procedures can be dedicated to, can be given to the technicians for if an articulator is used, and refinement is easy if articulators are used. Stop now. Coming to the classification of the articulators, based on adjustability, it is classified as non-adjustable articulator, semi-adjustable articulator and fully adjustable articulator. In non-adjustable articulator, an articulator that does not allow adjustment to replicate any mandibular movements. Example include class 1 and class 2 articulators. Semi-adjustable articulator, an articulator which allow adjustment to replicate average mandibular movements, which include class 3 articulators. Fully adjustable articulator which allows replication of three-dimensional movement of the recorded mandibular motion, which include class 4 articulator. Then next class type of classification based on position of condylar elements, it is classified as archontate and non-archontate. Next, based on the instrument function, it is again classified as class 1, class 2, class 3 and class 4 articulators. In class 1 again, it's a articulator which is capable of accepting a single static registration where only vertical movement is possible. Examples include slab articulator, hinge articulator and barn door hinge. Again coming to the class 2, an articulator which permits horizontal as well as vertical motion that does not orient the motion to the temporomandibular joint, which again it is divided into class 2A, class 2B and class 2C. Class 2A examples include Gridman articulator and Belgian brackets. Class 2B which includes articulator. And coming to the class 3. Class 3 again is divided into class 3A and class 3B, and again class 4 is divided into class 4A and class 4B. This is a mean value articulator, which is also called as class 2 non-adjustable articulator. It is used only if occlusion contexts are to be oriented in a centric occlusion only. It can be opened and closed in a fixed horizontal axis, and it has a fixed incisal table and condylar path. Is also called as 3-point articulator. Coming to the component parts, it's the upper member of the articulator, this is the lower member of the articulator, this is the incisal table, this is the incisal pin, this is the mid-incisal pin, this is the vertical supporting arm, this is the condylar. Coming to the limitations of the articulator is subject to errors in tuning and errors resulting from metal fatigue and wear. No articulator can exactly duplicate the condylar movements of an individual. It cannot compensate for any errors in jaw relation records. Come to the requirements. What are the requirements? There are like minimal requirements and additional requirements for an articulator. The minimal requirement, coming to only only the minimal requirements. It should hold the cast in correct horizontal and vertical relationship. It should provide a positive anterior vertical stop in sisal pin. It should open and close in a hinge joint. It should allow protrusive and lateral jaw movements. The moving part should move freely and the fixed non-moving part should be rigid. What are the additional requirements? It should accept a phase bow transfer record, adjustable condylar guide elements, a terminal hinge position locking device, mounting plates can.
Next step is notch indexing. It is a simple method wherein 3 V or C-shaped notches are marked on the 3 corners of the cast, one anterior and 2 posterior. The notches are created using a sharp knife or lathe mounted wheel. Disadvantages are if cast is trimmed to reduce the size, the indexing is lost. Next is articulation. Once the jaw relation is obtained or tracings are done, the casts are articulated using the records. The most commonly used articulators are mean value articulator and semi-adjustable articulator. Procedure. The occlusal rims fused with the centric record are placed over the respective casts. A thread is suspended around the articulator. A thread is suspended all around the articulator, running anteriorly across the mid-incisal pin to the point where the posterior horizontal pin meets the vertical rod. Wax blocks are stabilized on the lower member, one anteriorly and 2 posteriorly, and the occlusal rims with cast is placed over the wax blocks. The height of the wax is reduced or increased as required, such that the reference plane of the thread coincides with the occlusal plane and the incisal pin meets the incisal table. These are the instruments required for mounting. First, the upper member is swung open. Plaster is mixed and placed over the cast, and the upper member is then gently closed till the incisal pin touches the incisal table, and then the excess is removed. Once the plaster is set, the articulator is now reversed. The lower member is swung open and the wax blocks are removed. The space between the lower cast and lower member is adequately filled with plaster, excess removed and finished. The articulator is then cleaned, and once the plaster is set, it can be opened.
These are the requirements for the arrangement of the teeth. First, arrangement of the anterior teeth. Maxillary central incisor. Its long axis inclines slightly towards the vertical axis when viewed from the front. The incisal edge contacts the occlusal plane. The maxillary teeth slopes labially about 15 degrees when viewed from the side. The 15-degree angulation is more pronounced in the incisal half of the central incisor, and cervical margin should be within the occlusal rim. The position of the central incisor when viewed lingually is not straight but follows the arch form. Next, arrangement of the maxillary lateral incisor. Its long axis slopes more towards the midline. When compared to the central incisor, the incisor edge is about 1 mm short of the occlusal plane. A mesiolabial rotation usually looks good in a plane. Delicate patient and is called a soft lateral. This makes the tooth look narrower and enlarges the embrasure. It is inclined labially about 20 degrees when viewed from the side. The lingual view reveals distal margin overlap of the central incisor by the mesial surface of lateral incisor due to its inclination. The distal surface of lateral incisor follows the curvature of the arch. Next, arrangement of the maxillary canine on both the sides. Its long axis is parallel to the vertical axis when viewed from the both front and side. The cervical margin of the canine is more prominent when compared to the central and lateral incisor. It is less for the patient with a square face and more if the face is tapering. The tip of the canine contacts the occlusal plane. When viewed from the front, only mesially slope of canine is visible. Now we have to frequently check the glass plate relationship after the arrangement of the maxillary, central, lateral and canine. After the arrangement of the maxillary anteriors, now we will arrange the mandibular anteriors. Arrangement of the mandibular central incisor. Its long axis also indicates slightly towards the vertical axis when viewed from the front. The incisal edge is about 2 mm above the occlusal plane. It slopes labially when viewed from the side. The inclination is more pronounced in the incisal half of the central incisor and cervical region within the occlusal rim. From incisal view, it follows the arch form. Next, arrangement of the mandibular lateral incisor. Its long axis inclines to the vertical axis when viewed from the front. The incisal edge will be 2 mm above the occlusal plane. When viewed from the side, it slopes labially but not as steep as the central incisor. From incisal view, it follows the arch form. Next, arrangement of the mandibular canine. Its long axis leans slightly towards the midline when viewed from the front. The cervical margin is more prominent than the incisors. The incisal margin is 2 mm above the occlusal plane. From the lateral view, the incisal half of the canine is slightly lingually tilted and cervical half is more prominent when viewed from the side. From incisal view, the cusp is slightly more than 2 mm above the occlusal plane. The arrangement follows the arch form. Once the anterior teeth arrangement is done on the upper arch and the lower arch, check the relation in the articulator. Now moving to the posterior teeth arrangement. Arrangement of the maxillary first premolar. The long axis is parallel to the vertical axis when viewed from the front and the side. Its buccal cusp contacts the occlusal plane. The palatal cusp is slightly above the occlusal plane. The buccal surface of the premolar is in the line with the labial surface of the canine. Next, moving to the maxillary second premolar, its long axis is parallel to the vertical axis, similar to the first premolar. But both the buccal cusp and the palatal cusp contacts the occlusal plane. From occlusal view, the buccal surface of the first and the second premolars are in the line with the labial surface of the canine. After premolar arrangement on both the sides, check the glass plate relation. Now moving to the arrangement of the maxillary first molar. When viewed from the front, the long axis slopes buccally. When viewed from the side, long axis slopes distally. Only the mesiopalatal cusp contacts the occlusal plane and mesiobuccal enclosed cusp is close to the occlusal plane. From occlusal view, the buccal surfaces of the two premolars and the first molar are in line with the labial surface of the canine. Next, arrangement of the maxillary second molar. When viewed from the front, it slopes more buccally and than first molar. When viewed from the side, it slopes more distally than the first molar.
The mandibular posteriors should be arranged in such a way that it is in perfect occlusion with maxillary posteriors. This is how a final arrangement should look like. Thank you for watching.